What made us think that, there's light at the end of the tunnel was when AstraZeneca announced that the Oxford was going to work, and the Serum Institute said that they were going to have 1 billion units. And about 4 or 5 months ago, I spoke to Adar Poonawala, and I said, "Is it possible for the private sector to buy?" And he said, "Take a chance." So what we did is we took a chance and made sure that we got together a small project team and said, what would it take? And then, as Puanch will present, he said it's not about getting the vaccine, but making sure that it was administered correctly, that through the supply chain. And I think that's what he'll focus on. And that took us almost 4 months. And a lot of time, we were, again, much like the vaccine was till now in the dark, and you're building a plane while it's flying. This was also the case, that all of us were building capabilities ahead of the curve and saying, what is it we should do? How is it going to be administered? Anyway, the good news is that on Friday, the government actually finished the high-powered the committee actually finished their deliberations and came up with an entire document that actually talks about how this is going to happen. Phase 1, very clearly. In the first, phase 1 will encompass healthcare workers. They will be the first people to get it. And the frontline workers. Frontline workers meaning the police who are in the front lines maintaining, the sanitation workers, those who are helping the healthcare workers. All these will be the next level of people. Along with the frontline workers will also be the most vulnerable population. And this is very interesting. The conversation I had about why India defined 50 with comorbidities and above is a very interesting mathematical dialogue, that they said that many countries first had said, let us make it above 65, or let's make it above 70. But what, in the mathematical calculation, if we did that, the death rate would still be, if it was at 65, our death rate would still be around 55%. So, and then what happened at 60, if we did it 60 with comorbidities. And then finally, they recognized that if they could do 50 with comorbidities and above 65 years old, the population gets it first, we will bring down India's death rate by 80%, which means that it becomes almost a negligible statistic in India because, again, the protocols of treatment are so advanced that actually the death rate itself has dropped. And within that, once you have, the government has procured, they have supplies, supplies from two. There are only 2 candidates, and Puanch will explain it in more detail about why and what. But you will see in India that it is only the AstraZeneca Oxford and the Bharat Biotech. We've had personal conversations with the others, with many of the others, and I can quite confidently tell you that the next wave of candidates will be out only earliest April, possibly June. That the next vaccines will come out. And in that, there's a whole host of new vaccines, because India has great capability, whether it's Zydus, whether it's biologically with J&J, a single dose, and many others, the RNA, mRNA vaccine, the Genova, which is developed in India. All these will come out, and Puanch, please talk a little bit about it. But what I want to tell you is that first wave of these people. The government has put in place, they've entrusted the entire distribution to the public sector companies. They've said, use your CSR money, let's build the capability. My question to them is, what happens later? That's kind of going to go waste. But they said no. And the whole reason that they did this was because of the biggest problem is public unrest. So I think our responsibility as citizens is to recognize that the government understands what it's done. And those 300 million people, if the sooner they get it, the rest of the population that needs it will get it, that wants it will get it. And I think that's a very important criteria to take back this one point to say that when you are called, like when Harsh, you did say it'll be like an election procedure. So a little bit pretty much like that. Your number will come up, they'll call you, you book an appointment. You can't just go there to a polling booth and say, hey, I'm in this, I need a vaccine. It will be organized. You go there, there'll be an officer, there'll be a protection agent, there'll be an officer, there'll be an administrator, and all this will take place. So this is by and large so I asked them, what is the role of the private sector in this? Because you need a large number. The sooner we can get those 300 million vaccinated, then the others can get. So at that point they said, please offer your services. So whoever in this group of medical administrators or anyone that's there, this is the time for us to approach state governments, work with them, set up camps, go out there and see what we can do to augment. And then I asked, what's the price? I said, Apollo is going to get it. Why would you just give it to us free? We can give it from our CSR fund. And they said, very interesting. But right now we have to think about 300 million. And I think that the government is finalizing on that. But by and large, I think most of it is going to be free. The first wave is going to be free. So as administrators, we've taken a decision also that if the government is giving this free, it would be our call that if they can provide us with the materials that we require, we should do it free also and just serve in that first wave. So this is, I think, what the whole country will come together to make sure. Now, the second wave, and I do believe that the second wave will probably be when the demand and supply is going to start evening out, when you're going to get 5 or 6 candidates out there. And at that point, the private sector will be allowed to purchase. And they will be allowed to purchase. The pricing I've heard is anywhere between $10 to $20 a dose. And this is, again, 1 year from now, the price is going to be very different, much lower, when there are 100 candidates out there. But having said that, during that period, more and more people can do it. Our responsibility is to make sure we give the vaccine safe and there's no price gouging. And this is another responsibility of even the private sector that comes in, that we don't make money off this. And we make sure that, again, it's in an organized way. I would think by the time the second wave is over, my hope is that by Diwali, we would have achieved herd immunity, and the Festival of Lights will really be a festival of lights.